toward the end of my second trimester is kind of when things started to be not normal. And that's when we learned he had cysts on his kidneys, and it also involves the liver.
I was first evaluated for transplant when I was 16. It was a lot of like, when's it gonna happen? On the side, there was always just doctor's appointments, frequent trips to other hospitals around the state for other appointments, and lots of meds and lots of blood draws. And I think every person who's chronically ill thinks, man, I wish I didn't have to deal with this. But it's eventually, as I got older, I'm like, well, I have to deal with it. So I'm gonna make sure that I just don't stress about it and worry about it. I manage it. That I manage it and still go and live and enjoy.
Once we got referred to Nebraska Medicine and went through the process there, it was starting to feel a little more real. The thing we weren't expecting is that he would get matched and get a call so quickly after he was listed.
Colin had what we describe as a preemptive transplant from the kidney standpoint. He received his organs before he needed renal replacement therapy or dialysis. We knew his kidneys were going to fail. He wasn't at the point of complete failure, but it made sense to give him the kidney and the liver at the same time. Part of my responsibility is making sure that Colin is in the best shape possible to go to kidney transplantation. Nothing's going on. If there's something changing in his condition, we report that to Nebraska Medicine. We're the local resources for the patient.
We're throwing stuff into suitcases thinking, well, whatever we forgot, I guess we'll just buy there.
We're calling people like, can you watch our dog? Can you get our mail? I'm withdrawing from all my classes, letting my professors know I'm going away and not returning for a while. There's a lot of uncertainty going into it, which I think for me outweighed the relief of finally getting a surgery.
And I just remember that morning in pre-op when she came into pre-op and just was so non-doctorish. She was just another person and just like, it's all great. It's okay to be scared.
I'm in the 26th year of my fellowship, so I've been here in Nebraska for 26 years doing transplants. We do transplants on a very regular basis. But for Colin, it's the only time hopefully he's ever going to do it. For his mom, it's the only time she's going to be sitting in pre-op. And so when I talk to patients, whether or not it's in pre-op, in the clinic, I have to remember that this is their time.
She kind of put her arm around me and just like, everything's going really well, so I think we're going to continue and do the kidney now as well. She's awesome. I can't say enough good things about her.
I can help them by doing the operation, but I think over the years I've learned I can help them more by empowering them to help themselves and feel positive and believe in themselves.
Top tier care. I've been to another transplant center and I was treated so much better there at Nebraska. The attention to detail there actually is probably the thing I want to highlight most because they make sure that patients are the top priority. I did not feel ignored by the doctors and the other healthcare professionals at Nebraska.
Colin is doing incredibly well. He had very minor hiccups post-transplant period. Some of the higher complexity cases, such as Colin, are better handled going to a center such as Nebraska Medicine. It's a valuable resource to have a transplant team with the expertise, and especially if we're dealing with a patient down the line who has difficulty with their transplant. It was a very smooth process getting Colin through the transplant process. The communication was very good between the institutions. All of Colin's records popped up in my EMR, so I can easily review what was going on and what needed to be done.
So many of the barriers to healthcare that we know about have to do, can you physically get to the hospital? Do you have enough money to take the gas from wherever you are to get to the hospital? And then if people have to start thinking, oh my gosh, how am I ever going to get to Omaha? The fact that we can go to them, being able to minimize the stress by once every 3 months not having to travel and miss work and miss school and do all that kind of stuff. It's good for the patients. And I think it's also really good for the team at Monument to feel like they have a safe resource where they can get help for their patients. I think really eases a lot of the angst.
I'll have to go back to Omaha once a year for a follow-up appointment, but other than that, a lot of my follow-up care will be here.
Just the fact that kind of the partnership with the liver folks coming here now makes communication seems like a lot more seamless and I think less work for us.
Once I came back, I finished up all the classes that I suddenly disappeared from, and I'll be graduating from South Dakota Mines in December 2026.
It's interesting to see where we started when he was born to where we're at now. It's definitely been a journey.
Whatever he wants to do, life, work, kids, anything. That's why we do transplant. I mean, he's living the transplant dream.